Melissa, pelvic health physical therapist and birth doula, here to tell you a quick story. I was talking with one of my birth doula clients about the birth process, and we got to the part where the placenta detaches from the uterine wall and leaves a wound inside the uterus the size of a dinner plate. This is where the bleeding, also known as lochia, happens after birth. This is also why we tell new moms to stay in bed or relax and watch their activity, because this wound needs to heal. Well, she proceeded to tell me how her mother, after giving birth to her brother, it was in December, and she did Christmas shopping and all the Christmas things, and ended that with, well, I guess my mother is just stronger than the rest of us. Well, I asked her, how's your mother today? Pelvic organ prolapse, urinary incontinence, and she said, oh, my mother is a mess. The point I'm making is that one of the things we need to realize is what we do throughout our pregnancy, throughout our labor and delivery, and then that postpartum phase will directly affect what happens 20 years down the line. So you may be fine in that moment, but how are you going to be when you're 60, 70, 80? Those women in their older years who now have problems with pelvic organ prolapse or urinary incontinence could often trace it back to something that happened in the birth process or the lack of postpartum care. We provide rehab for almost all other trauma, injury, surgeries that happen to us, with the exception of pregnancy, labor, and delivery, including cesarean sections, which are major abdominal surgery. It is my belief that all women should have physical therapy prenatally and definitely postnatally. You may heal just fine and do just fine for 20 years, but how are you going to be in those later years? So Cholula and I are here to advocate, to help with postpartum physical therapy. How can we help you? In addition to what I've said, I want to add that if you are now one of those women, 60, 70, 80 years old, and are having problems with that, it may not be too late. We can still help you manage some of those symptoms, manage some of the pain, and do some things that could be helpful to improve your quality of life.